Mayor Muriel Bowser. Mic check. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Moving on. Dr. LaQuandra Nesbitt. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10, 9, 8, 7. Moving on. Director Chris Rodriguez. 1, 2, 3, 4, 5, 6, 7. Moving on. Mic check. 1, 2, 3, 4, 5, 6, 7, 8, 9. Moving on. One, 2, 3, 4, 5, 6, 7. Good there. Floor or polycon?
Test 1, 2, 3, 4, 5, 6. Okay.
And now, we bring you the following live press announcement from DC Mayor Muriel Bowser. Our regularly scheduled program will resume following the announcement.
Good morning. I'm Muriel Bowser. I am the mayor of Washington, D.C. Today we will provide a situational update on COVID-19, specifically answering some questions about testing and contact tracing. I am joined today by members of my administration, as well as Malachi Stewart. And Malachi is a member of the D.C. Contact Trace Force, and he will share some about his experience doing contact tracing. This morning, I also want to share with you our numbers related to COVID, particularly that we report 63 new confirmed cases, bringing the total to 9,500 of positive cases in Washington, D.C. We also sadly announced yesterday that 4 Washingtonians succumbed to the virus. As Dr. Nesbitt explained on Friday, the earliest we expect to move into phase 2 will be June the 19th. We will be monitoring data very closely, and we will believe in the coming days we will also have a sense of the impacts about moving into phase 1 and what impact that has had on our experience with the virus. And let me also just ask Dr. Nesbitt to say a little bit more as a recap of our last discussion about what the phase 2 metrics are.
Sure, thank you, Madam Mayor. Today I also want to give an update as to the way that we will be making data available on the metrics in phase 1 that are critical to our decision making about the earliest when DC Health can make a recommendation to the mayor for transitioning into the next phase of reopening. Today, we will have a dashboard added to the coronavirus.dc.gov website under the data section that will provide progress on our data metrics for phase 1. Here you can see where the status is as it relates to the metrics that we are using. If you go back to the previous slide, as the mayor mentioned, our decision making, even though we continue to count continued days of decline, our ability to fully understand the impact of the phased reopening that began on May 29th begins, as you can see and is indicated, consistent with the symptom onset of May 29th that begins to be measured, which contributes to our ability to make a recommendation for moving into phase 2 no sooner than June 19th. Also, as you can see on the slide, the dashboard, as it has gone live today, one of the systems that will give us information on our contacting tracing capacity, that system will go live tomorrow. And so today, if you go to that dashboard, you will see that those 2 indicators related to contact tracing will indicate coming soon. That's because we're in the process of switching to a new data system that our contact tracers use that give us our status as to where we are in meeting that metric. So that's all I have.
Thank you. And we just want to reiterate that we have expanded testing in our neighborhoods, and we want everyone who needs a test to get a test. It's free. You may walk up without an appointment, and you may continue to call our 1-800 number for information about testing sites. But I want to let you know what's open today. Among all of the sites where you can call for appointments, you can walk up to the following locations: the downtown site on F Street, our site in Anacostia, as well as Engine 10 on Florida Avenue in Northeast, and Engine 30 also in Northeast on 49th Street. The fire station sites are open in the evenings, Monday through Friday, and on Saturday, which is not on this site, 12 to 4. And if Director Gelhardt, if I could ask you to say a little bit more about the fire station sites.
Yes, ma'am. We have the fire station sites, as you see here, for this week listed. We will be going into next week actually doing 4 sites per evening. So we'll have 4 sites generally in the south and southeast side of the city. We basically split the city in half. The same sites that we've been doing this week, we'll just put them out there more frequently. So Monday, Tuesday, and Wednesday you can do on the southeast side of the city, the south and southeast, southwest side of the city. And then on Thursday, Friday, and Saturday will be the north and northwest, northeast sides of the city. We'll put that up on the coronavirus.dc.gov this week so that folks can see the sites that will be available. These are evening sites. They'll be available from 4 p.m. to 8 p.m. for folks to come. We've been seeing good attendance out there. We appreciate that. And again, as the mayor has said, if you need a test, these are here for you to get a test. Please come to your firehouses that are on the site to get tested.
Okay, thank you for that. And already, I think this week was the first week where they've all been up, and over 500 people have gone to a neighborhood firehouse to get tested. So one question that we get a lot, and I'm going to ask Dr. Nesbitt to help with this, is what questions should you ask yourself to figure out if you need a test? So obviously, if you have symptoms, you don't feel well, or you know you've been exposed, you should get tested. You should stay home as well. If you are concerned that you have been exposed while out in the community or out at one of the demonstrations, we urge you to get tested within 3 to 5 days, between 3 and 5 days, not sooner, and get tested. And so let me ask Dr. Nesbitt just to talk through these groupings.
Sure. As we have been encouraging members of the community and have done a lot of education about the expanding signs and symptoms of COVID-19, we want to make sure that people are having those discussions with their healthcare provider in terms of consulting with them about their need to have a test for COVID-19. We've done outreach to healthcare providers in the community to ensure that they have the capacity to offer testing in their office. We want individuals in our community to reach out to their healthcare providers to make decisions about their need for a test. If your healthcare provider is unable to offer you a test in their physician's office, then we have a number of options, as has been highlighted, that are free for district residents, are free for healthcare providers who offer care here in the district and any of our wonderful healthcare facilities to receive testing. And so we want to make sure that all of the residents know about those testing options, but also importantly that healthcare providers in the district who have not yet developed the capacity but are working on the capacity to offer testing to their patients know that they can direct their patients to these locations for testing if they call them because they are experiencing symptoms. Now, as we will talk further in the briefing today about contact tracing, when individuals who are close contacts to people who are known to have COVID-19, we are recommending that they get tested. Now, testing does not replace the need to quarantine for 14 days. But we do recommend that they get tested, and we have a time frame that that testing is recommended. So about 3 to 5 days after their last contact with the known positive individual. And as the mayor has mentioned, as we have more people moving around in our community because of the phased reopening, so more people may be returning to work, more people may be participating in phased reopening activities, or have attended First Amendment activities in recent weeks. And we strongly encourage those individuals to be monitoring themselves for signs and symptoms. And if they have participated in a First Amendment activity, we have guidance on the DC Health website for mass gatherings that encourages them to telework if possible for 14 days. And we want them to restrict their movements, which is not the same as recommending a quarantine for those individuals, but being more judicious and mindful about their level of activity. We recommend for those folks as well that seeking testing would be wise, but it is recommended that you wait for 3 to 5 days after having participated in those activities where your exposure may have been increased.
Thank you,
Mayor.
Dr. Nesbitt. And so what I frequently ask the team is to make sure people know what it is when we say contact tracing, what they might be able to expect. Similarly, we have tried to let people know what they would expect when going to get tested. So you all have been hearing us talk about our building up our contact trace force. The Department of Health, this concept is not new to them. It is a key part of their public health work. And they already had a contact tracing team of about 65. We've built that team up to 200. We are going to add an additional 100 DC government employees who will be detailed to the trace force by June 15th. And we have another reserve group of DC government employees who could be drafted into the contact trace force as well. We also continue to be able to tap into a group of applicants who have applied for the trace force that we can flex up our team as our experience with the virus dictates. So I wanted to also mention, and I think I've mentioned before, that our entire DC government workforce will have a very rudimentary training in what contact tracing is, because we also think it's helpful to them to understand the virus and be able to answer resident questions. So all DC government employees will take a portion of that online training by June 30th. So with that, I wanted Dr. Nesbitt and the health team to tell us what contact tracing is all about and what you can expect if you receive a call from the health department.
So thank you, Mayor, and we really appreciate this opportunity to outline for individuals what we have come to know nationally as contact tracing, which is a detailed process of identifying individuals who are COVID-19 positive, investigating their cases, and then contact tracing individuals. What we describe as case investigation is really a detailed interview that is usually done over the phone with residents who are confirmed positive with COVID-19. And that allows us the opportunity to identify all of their close contacts. The contact tracing process is what happens after that, where we notify, interview, and conduct what's called public health monitoring individuals who are the contacts of the original case who have been exposed to the virus. Now, what we do during this process is we get information that is required to be reported to us by law, the communicable disease laws that every jurisdiction has that allows them to have information on communicable diseases, which are diseases that are transmitted person to person, and in some cases may be transmitted from other non-human, what we call vectors. This data is used only for statistical and public health purposes, and so its use is very restricted and is governed by very unique and strict sets of laws. Next, I'm going to give a set of information about what people can expect if they've tested positive for COVID-19, the types of things that we ask about at DC Health. We collect some demographic information, and this is things such as the race and ethnicity of the individual if that has not previously been reported to us. We also like to confirm age or date of birth as it may have been documented by the original tester or healthcare provider. We also want to know how the person is feeling overall, so we can get a sense of if the individual was with symptoms or without symptoms when they were tested, and if they were without symptoms when they were tested, if they've developed symptoms now. And it's critically important for us to be able to put together a picture of who's developed COVID-19 in the District of Columbia. And as a result of that, we do ask questions about certain risk factors that a person may have had for their exposure. So if they work in what's called the high-risk professions, where contact with individuals will be highest, or if they live or work in congregate settings. Other things that people should expect is for us to ask about their recent movements. So it gives us the ability to begin to identify their contacts. We want to know their household information and living arrangements. So it will give us some idea of who else may be at risk, or if there were already previously diagnosed individuals in the household. And then we get to put together their list of contacts, and to the best of their ability, if they have contact information for people who we've identified as being their close contacts. Again, this information is critically important to helping us be able to help other individuals who may now be at risk get the support that they need, direct them to testing, and help to have more people quarantined. Quarantine is important for us to be able to reduce the spread of COVID-19 in our community. What not to expect. So for as much as we talk about what contact tracing is helpful for us to tell people what it isn't. We are never going to ask you about your immigration status. We're also not going to ask you for your social security number. We don't need that information to conduct our business. And we also are not going to ask you about your financial information, such as bank accounts or credit card information. Even if you tell us that you need social service support or human services support, we do not take your own financial status into consideration to be able to support your needs for housing services support or for food access services or things like that in the district. It is more important to us to be able to provide any of the services that you need than for us to know about your own economic or financial status at this point. So what happens after we've done the interview if you're a positive case? You will get instructions and support on us how to isolate. We'll describe to you what it means in terms of we want you to identify the room that you will sleep in and spend your time in throughout the day. We'll also ask you to identify the bathroom that you'll use if you can choose your own bathroom, and if not, we'll give you instructions on what to do instead. We'll also call or text you twice a day. You get to choose the way that you want us to communicate with you. And the purpose of that is for us to ask you about your symptoms so we can figure out when you are recovering and when you can be removed from isolation. We'll encourage you to be in contact with your healthcare provider for the management of any signs and symptoms that you have that may indicate that you may need to become hospitalized, or if you have other chronic healthcare conditions that need to be managed. You will not have to call your own contacts, and you will not be identified to your contacts by DC Health. So we do maintain a level of anonymity for people. So if you work in a business, work in the food service industry, we are able to conduct our business without disclosing who the positive case is to your close contacts. If you're the close contact of a positive case, we will call you to provide you notice about your exposure and to provide you support. We ask the same information of close contacts. The contact tracer will gather information, demographic information, health information, get a sense of risk factors, and also ask about household information and living arrangements, because quarantine and isolation tend to follow some of the same requirements in terms of staying away from other people, not participating in activities outside of the home. As we mentioned before and earlier in the discussion, we do refer for testing and clinical follow-up individuals who are close contacts. So we're going to give you guidance on how to seek testing typically within that 3 to 5 day window for anyone who is a close contact of a COVID-19 positive individual. I want to emphasize here, if you are in quarantine and you are tested, if you test negative, you will still be required to complete your 14-day quarantine. So testing and having a negative test is not a replacement for the quarantine. The quarantine is still critically important. And we're going to be in touch with you twice a day if you're in quarantine as well. This is a schematic that we have drawn that articulates what the case interview process looks like. So all of our interviewers, or people who are affectionately known in the community as contact tracers, so they are all assigned cases. They pick up the case and they carry multiple cases at a time. They call and they interview the positive cases as well as the contacts. They conduct the interview. They collect all of the information. They enter this information into the system. They identify any resource needs that people have. They document this information into our system, and the technology is very robust that we use. The contact interview begins calling all of the close contacts, and if necessary, directs them to testing and other resources that they may need. And then the contact interviewer reaches out, if necessary, to businesses and public places where the positive case may have gone, to notify them of any actions that they may need to take. So if a COVID-19 positive individual was in a business or public place, and that business now may need to close for 24 to 48 hours for deep cleaning, or needs to take action to assist us in notifying close contacts, that further action may need to occur. So this is sort of the schematic of the process that goes on. And it's critically important that everyone participate very actively in the contact tracing process. It's helpful for us in this phase 1 that we are able to make contact with 90% of our positive cases, and that we are able to make make contact within 2 days of that positive case giving us the list of those close contacts. We want to be able to be in touch with them within 48 hours so that we can give them guidance and that they can quarantine. Being able to do this for 90% of close contacts, and being able to make contact with 90% of our positive cases within a day is highly effective in us being able to decrease rates of transmission of COVID-19 in our community. We have set these as our phase 1 goals. It's consistent with what other jurisdictions are doing, and this is what's going to help us decrease rates of transmission in the District of Columbia. And so now we want to have Malachi be able to talk about the experience of working on this type of work at DC Health, and talk about what it's like being on the front lines of this response.
I work originally as a disease investigator, focusing on infections and diseases that are sexually transmitted, as well as tuberculosis. I was detailed for the contact trace force in the beginning of March, and what I would say to my experience is that the most important thing, even as you see like the slides and you see sort of like the schematic flow of how we do interviews, how we do contact tracing, the most important aspect of that is really the participation of the community that's tested positive. Those initial case investigations where people are giving us the information, where they're willing to recall some of their activities within like the period of interest that we're looking for, that has been the most important thing. Because that's the work that really helps us to be able to know who to contact, how to reach out to people, even people being willing to take the extra time to look in their phones or check Facebook, using social media to reach out, to be able to find people's information so that we're able to really reach people who were potential exposures. So I would say that to the work, that my experience has been that the majority of our success can be attributed to the public's participation. And just want to encourage people that I know that a lot of times when we make these calls, that initial conversation can feel really weird. You're having someone call you, asking you really personal questions. It's not weird to us who've done this work for a long time, but we acknowledge that it's weird. We acknowledge that we are sometimes contacting people when they're really afraid. And they don't always have resources. And so a lot of times we are sensitive to the idea that we have to address first the need before we can ask anything of you, but just wanted to encourage people that will be contacted, people who are potential exposures, to participate as much as possible, because it's that participation that allows us to continue to achieve success and really see the curve be flattened.
Thank you, Malachi. With that, we'll answer some of your questions, and I think you hear loud and clear from Dr. Nesbitt and from Mr. Stewart that please just answer the phone. It's going to be the health department calling, and you have seen how they will treat your information and how important it is for our community's health, for our public's health, that you participate. Okay, any questions? Yes. I am. I'll be going over to Anacostia, and I'm going to a site that we want to make sure that everybody knows about, and that you don't need an appointment, that you can walk up to the site. And we want people who need a test for all of the reasons that have been cited, that they are going to get a test. I'm an essential worker. I have been exposed throughout the pandemic, and I have been tested throughout the pandemic. Yes. Yes.
Following up on that, Mayor, how many times have you been tested?
Twice.
Twice. Negative?
Yes.
And you were seen at one of these protests downtown, standing in a large crowd of people where you had taken off your mask, and there was some criticism over that. Is that the reason why you're getting tested today?
I'm getting tested today because I have been out and about probably more than I have been, and I expected to be out and about more because we're in phase 1, and that's why I'm getting tested. I feel great.
Secondly,
yes.
I just checked, and it was back on April 3rd when you and Dr. Nesbitt and others held a situational update like this for us over at the Armory. And there was an estimate that perhaps, under the Chine model, there would be 93,000 positive tests and 1,000 deaths. And here we are in early June, and you haven't even come close to that. What's your take on that, Mayor? What's your analysis on that?
I don't know that I have an analysis, Paul, other than to say we have relied on a number of models, and they are models. And all of them, the outcome or the cumulative numbers based on all of those models depended on how well we adhered to social distancing in the beginning and how well we open up. I think you probably know, I think that model, Chime, has been updated to reflect reopenings. Is that right? That has been updated to reflect reopenings, because now you can have a certain set of expectations when everybody is on stay at home, and then you have different expectations as we reopen.
I'm just wondering if perhaps with those numbers, which were shocking to all of us at the time, and the fact that you haven't even come close to that, would you call that a success based on what you've asked the district residents to do?
I think that district residents and businesses have sacrificed a lot. It would be hard for me to say I'm happy that over 400 people have died. It would also be hard for me to say that we think it's a success that we have some racial disparities reflected in those numbers that say a lot about health disparities in our city. Certainly, I think that we feel grateful that we've had that time to make sure that our health system can accommodate a spike in cases and very serious cases. Yes.
We're getting some sort of confusing signals between Park Police and Secret Service as to the fencing around Lafayette Park, Lafayette Square, when or if that's going to be taken down. Is that something your administration has any input into? And second question, there appears to be an effort to preserve some of the pieces of artwork and signs and messages that have been placed in that fencing. Right now, there appears to be an effort before the fence comes down to save that. Do you have a preference on what could be done with some of that memorabilia at this moment in history?
Yes, we have communicated to the federal government that we want to see the fence down. I believe they also got a communication from the Congress for the same reason. And here's why. It's a public park. People have accessed both sides, the north and south side of the White House as a public park, and that green space, recreation space, meeting space is important, not just to us in Washington, but to the whole country. So we think it should come down. Our understanding is they're in the process of taking it down. We are also in the process of supporting in every way we can. I've asked Director Geldhart to work on this in preserving the artifacts from the protest. And we will have the opportunity to preserve those in our own archives or share those with other institutions. Anything to add with that, Chris?
No, ma'am, just that this morning, along with many of the citizens, residents that were out there, we assisted in moving the signs that were on the fence over to many of the boards that have boarded up the windows along H Street so that they were not affected when they brought down the fencing. So most of all of that, as the time I left, had been moved over. So we are attempting to preserve as much of that was out there.
But took part in that effort?
We assisted, yes.
Yes.
Yes. I know you had expressed to the council yesterday some caution in asking them to move slower on the Emergency Act on policing. Now that the legislation has passed, I was hoping you would tell us what you thought of the steps that they took.
Well, actually, I don't know what you say, if you're referring to a note that I sent to some council members. I think our questions were about, like we would have on any piece of legislation, that we had the opportunity to weigh in, that we could review and anticipate any consequences, some unintended consequences, and also that the public have an opportunity to weigh in. The council, as you know, is in a modified operation as well. So opportunities for the public to weigh in a hearing or even down at a committee meeting are limited. So I think especially on some of these topics, some of which are codifying guidance that already exists, others are more substantive in their changes. We also encourage them to sometimes our legislature, when we do a emergency, there's also what's called a temporary act. An emergency lasts 90 days. A temporary act lasts the better part of a year. So we think moving urgently without substantial input could be warranted on a 90-day basis, but we need to think a little bit more about the permanent piece of legislation.
Tell me substantively what you think of some of these steps that they passed yesterday on an emergency basis.
I think we commented that we were supportive. Any other questions? Yes.
Would you, I know clearly it was a veto-proof majority, but would you consider vetoing that
I'll sign the emergency.
And adding on to her question, they added some stuff to it yesterday. For instance, banning MPD from using pepper spray, tear gas, that sort of thing on protesters? Or are you in support of what they added yesterday to the bill?
Again, I'll have to look at it in more depth. I thought that there could be some things added that weren't circulated that none of us have had the opportunity to weigh in on in my administration. So I would need to circle with my directors and give them some formal feedback.
The police union that this was kind of too fast?
I think that there was some urgency. I know that the council felt that they needed to act urgently on some issues, and they have the ability to do that with an emergency piece of legislation. Yes.
When we interviewed the director of human resources back in, I believe, early May, the number was about 900 contact tracers that the district wanted. Has that changed at all? Is there a phase 2 metric in terms of the exact number of contact tracers you want before entering that phase?
No. I think did you see the metrics? I will go back to the slide with the metrics. The metric is how soon can we make contact with a positive case and how soon we can make contact with their contacts. And that is how we contain the virus, getting in touch with the people who we know are positive and the people who we know have been exposed to them, and making sure that they get the right information and that they isolate. And how we do that is making sure we have the right number of people. So Dr. Nesbitt and her team have the ability to flex up. We'll have a reserve group of DC government employees. And if our experience with the virus suggests that we need even more people, we can hire more people. And
the number is not necessarily a...
We still think that's on the outside. That's an outside number, and you might not necessarily need them all at once. Yes.
Can I ask about how you're communicating with the public about public health and these protests that have been going on? And originally, you had discussed the demonstrations as large group gatherings that would be discouraged under the safer at home orders, and then you attended them yourself.
No, what I said was that there is a public safety definition and there's a public health definition. And for public safety, this is a First Amendment demonstration in the District of Columbia. And people have a right to exercise their First Amendment rights, especially in the District of Columbia. That's our view. The Public Health Department doesn't have the responsibility of managing or supporting First Amendment demonstrations. So, and I put words into Dr. Nesbitt's mouth perhaps, but I think for them, it's still a large gathering. And all of the things that they are concerned about large gatherings are present in a First Amendment demonstration.
In terms of testing now, I saw on this list, you're encouraging people, if they believe they've been exposed, to get tested. Is that anybody who attended one of these demonstrations? If someone does test positive who attended, are you going to publicly communicate that there was someone with coronavirus at these demonstrations?
I'm not sure I follow what you mean.
Your contact tracers find out that somebody tested positive for the virus after attending one of these. Are you going to make that information public to anyone who may have attended, or is that going to go only to their personal close contacts?
Yeah, I think that the Department of Health, and we've had, I think, only one incidence of this so far where they have identified a hot spot, and that was at a church early on. And I would guess if there was some other hot spot that was associated with the demonstrations, that might also be communicated. Yes, I'll take another round here, starting with Paul.
Okay, Mayor, let me go back to the emergency legislation. This would say that officers involved in a serious use of force incident, their names would be released within 72 hours and the body camera video would be released. I believe in reading your letter to the council yesterday is that you were not in favor of that part of it, at least the body camera video. And let me just ask you this. As far as naming officers is concerned, it's my understanding that there had not been a policy on naming officers. The last time it was done by you was naming Brian Traynor in the Terrence Sterling case.
I don't think we commented specifically on any part of what the council moved yesterday as it relates to body-worn camera. Only that the body-worn camera policies that we have in the District of Columbia were carefully considered by a lot of parties. Our administration, the council, the public defense groups, the prosecution groups. So it's a lot of consideration of what was best for public safety and justice in the District of Columbia. So I actually think that that should be pulled out of a omnibus and carefully considered.
Naming of officers.
You're testing my memory now, and everything related to body-worn camera and naming for us is about justice for the victim and how we get to justice for the victim. And some of these discussions, we always have to be concerned about protecting the investigation and the prosecution. So when you say that, it's not a very simple thing to respond to, because we're seeking justice for the victim, and anything that would hinder an investigation and prosecution, we would be concerned about.
But would you agree, though, that currently, before you sign this emergency legislation into law, you're the only one responsible for being able to release police body camera video and the name of an officer currently as it stands right now? Is that correct?
The law is pretty particular about use of force in fatalities and when the body-worn camera is released. I think this may change the time frame, and again, you're testing my memory, because right now there is a consultation that is required from us with the U.S. Attorney and I believe the OAG. So there's a consultation period, and then there's also a review period for the body-worn camera.
You're not agreeing with me that you solely have the authority right now under the law as it stands to release body camera video in a use of force and the officer's name?
I have the authority according to the law that's very specific about instances when body-worn camera would be released, yes.
Asked to release certain body camera video and have turned people down.
Paul, if there's a specific question you have, I can answer it. I can't go all the way back and just say that absolutely.
All right, then just to finalize this emergency legislation basically changes this drastically. It says the law will now say that within 72 hours of the serious use of force involving a police officer, those names will automatically be released and the footage will be released. Is that correct?
Let me look very closely at what the council passed, and I'll answer that question. But the council can answer that for you. Yes.
First, I wanted to ask more about the contact tracers. It said on the metrics 90%. I know it says not applicable today, but on Friday it said that you were at about 54%. So how about, you have said you have over about 200 contact tracers now. How many would you need to reach that 90% metric?
So the reason why we're not reporting out on the metric today is because we're switching data systems and the data gets exported from the data system. So as we are switching from one system to the other, the data collected in the system, if we were to report it out of the same system that gave us the 55%, it would be erroneously underestimated, okay? So we have the ability to calculate it manually, but it is not a good use of the staff's time to be tabulating that manually to be able to meet the timeliness of reporting that we like to do to put it on this document. So I've made the decision that for the 2 days that we are in transition with our technology, we won't post that metric publicly. So when the new technology goes live on Thursday, yes, tomorrow on Thursday, that metric will be reported. As the mayor has stated that we have the ability to flex up and flex down to meet the metric of 90%, we will be monitoring what it is. When we made the estimate of using some of the modeling that we were doing, that with a certain number of cases that we may have, which is what we call the daily incidence on a given day, using a ratio of 1 case may produce 8 contacts. We may, on the very outside of an estimate, being super conservative, may at most need 900. We're not nearly there where we would need that size of a workforce.
Maybe a couple months ago, or like in this past time, you said that the area of like 16th Heights and Columbia Heights, those were hotspots. Are those still areas of concern?
Yes, that is still where we're seeing a high, what we call a high test positive rate in those areas, which is what we are using to define what we call a hotspot.
And over Memorial Day weekend, you reviewed the data because not so many people were tested as maybe you needed. Is that something? How many people need to be tested daily for that not to be an issue? Are you seeing that enough people are getting tested?
As you know, we do not have a targeted number of individuals that we want to see tested. What was concerning for us is that week to week, the number of individuals being tested in the district was broadening. And we had started to see a reverse trend, which was concerning to us. This week, as the mayor and Mr. Geldart has mentioned, we are seeing some of the highest testing over the past couple of days that we've seen at our public testing sites. And so we're going to continue to observe that over the course of this week.
One last question. On the graph, you kind of mentioned that you weren't prepared to say how the impact of phase 1 you won't be able to see the impact of phase 1 on community spread. I just want to clarify the graph. It looks like that data point is on the border of that new shading to see the impact. Is today the first day you can see the impact, or is that tomorrow?
That date, I believe, references to May 29th. If you go to the dashboard, and I encourage all of you to do that, when you hover over any of those dots, it's going to tell you exactly which date it refers to. So you remember we entered phase 1 on May 29th. I believe that date on there, on that chart, is May 29th.
What would be the first day we could see the impact of?
May 29th is the day that we opened and people had activity. So if somebody was tested and said my symptoms began that day.
Like tomorrow, would we be, like tomorrow, the data released tomorrow, would that show the impact of phase 1 on community spread?
I'm trying to follow your question. That, I believe that died, and this is why I don't want to give you a definitive yes, because I can't see that from here. And those hash marks are really small, which is why I'm telling you to go to the dashboard and hover over that dot. Because I know if you go to the dashboard and hover on that dot, it's going to tell you exactly what day that dot refers to. But that line is May 29th, that color shaded area.
Okay, yes.
We had the National Guard, the DC National Guard said yesterday that some of their members have tested positive. They wouldn't get into details on how many. We had, by our count, 11 different National Guard contingents in the district over last week, plus federal agencies and some we can't even count. I guess my question is for Dr. Nesbitt, is the medical implications, given the circumstances out there during the nights when the protests were the most intense, would you advise that any member of the security contingent, be it National Guard, Park Police, Secret Service, get tested? Anyone who was in Lafayette Park or out on the streets during that period, would that be the most medically prudent thing to do?
I'm not sure that we've been contacted by the federal government for our advice for federal forces, but certainly they have many professionals in infectious disease that work for them, and I'm sure they're consulting them. We have also not been asked for any assistance from the DC National Guard, and I can't confirm for you any specifics about those press reports. Yes.
For Dr. Nesbitt and you, Mayor, how concerned are you that a spike could be coming just given the protests that continue How concerned should the public be that a spike could be coming? And then Mayor, for you, the protests have, the quote unquote protests have continued, but it's turned more into kind of a street fair atmosphere. You got people selling food, music, a lot of kids down there. Are you okay with that continuing, given what we know about how COVID spreads? And is there any discussion at some point of saying, you know, we can't have the large crowds gathering down on H and 16th? Yes, you can go down there, but we can't have large crowds.
So is your conclusion that the protests have stopped?
No, I'm protesting from the standpoint of we're not seeing as much people staying stagnant, chanting, screaming. There still are some people doing that and they're marching, but there are portions where you just have people chilling, having hot dogs and hamburgers, people, you know, listening to music, just gathering and sitting and just kind of taking it all in.
Okay.
Are you okay with that continuing?
We have an obligation to First Amendment rights. People are not under a stay-at-home order, but we also have some interest in making sure that there's not gathering, or that if there's food, that it's being sold in the right way, according to all of our health guidance.
How concerned?
You know, I think the mayor has articulated this best in her previous statement when she said that there are separate issues around the First Amendment things and the law enforcement aspects that were spoken to in a very clear and concise manner. And from a public health perspective, we still view these as mass gatherings that would not be advisable given the current state of affairs that we are in. With the pandemic and where we are in from a community spread perspective. As we have discussed these issues from a public health perspective, it clearly presents a complicating epidemiological set of factors where we have phased reopenings happening across the country at the same time that we have mass gatherings. And so we are going to be left through the use of the tools that we have to, as best we can, continue to monitor the situation. We have in the district responded by providing people the best guidance we can in terms of how they can participate and exercise their First Amendment rights. We have also responded in kind with offering testing for folks, and also giving them guidance as to how they can restrict their movements after having exercised their First Amendment rights, so as to decrease the risk that they could potentially be posing to other members of our community afterward. So that is what we can do from a public health perspective to mitigate what could be on the horizon. But I do want to make sure that we recognize that these are very complicated epidemiological factors that are at play, but we need to also understand that there is a duality here from a First Amendment perspective and the public health aspects of what we would prefer not to have to see from mass gatherings.
All right. Thank you, everybody.
We now return to our previously scheduled program, already in progress.